In this episode of Dr. VGP podcast, we are excited to host Honorable UT KHADER FAREED, Karnataka's Minister for Health and Family Welfare, a leader for the past 25 years as the member of the Legislative Assembly representing Mangalore in Karnataka, is known for his accessibility, administrative experience, and people-centric approach. And today, his vision for strengthening public health, improving the medical infrastructure, and ensuring quality healthcare that reaches every citizen of Karnataka. Welcome to Dr. VGP's podcast that reaches 42 million households, including 38 million across India and 2.4 million in USA. Today, we have a very unique guest, a mover, a shaker, a no-nonsense statesman from the state of Karnataka, Karnataka's Health Minister, Honorable Mr. UT KHADER. Mr. KHADER has been a member of Legislative Assembly for 25 years. Sir, we welcome you to the show, sir, today. And you have been an innovator. This is the second innings for you in the health department. Tell us some of the highlights of how you're transforming this to be one of the most people-oriented health. You're making health great again, making Karnataka great again under your leadership. Tell us about the cochlear implant here, which are giving free services, your bike ambulance, something innovative, your sea ambulance, and then your Good Samaritan Act, which you've banned Gutta, and also the innovative insurance and accident insurance scheme you've involved. And the best, which I heard about, is dentures for senior citizens and how you're giving the ASHA workers an incentive. Please tell our viewers there, sir.
See, a healthful society is the main of our government. 2013, when I took up various schemes were bought. One is, as you say, the dentures for the senior.
Yes, very interesting.
See, we want each and every poorest of the poor, who is above 60 years also, to smile in a good way and to eat healthy and be healthy. So you see, any area you go, above 60, they are mostly neglected. No one is there to talk to them.
Yes.
So we thought of giving a free dentures. For everyone should smile happily and they should have a healthy food. To few people, they have their parents, they have their children or relatives, take them to this take this free scheme. But some, they won't have anyone, either one old lady or old grandson, either they're financially weak, they won't have knowledge. In that sense, we may health first ASHA workers, whoever identifies them, gets them to our center where we give the free dentures and teach them. After the 3 sittings, the dentures will fit to them. We will not only have free dentures for the patients, for the health facilitator who has bought, we'll give them incentives. That is our intention, because each and everyone will be identified and take this benefit. And now, after it was the first in Karnataka, later the central government also has adopted a scheme throughout India.
Fantastic. You are a pace setter and a transformer, Chief. Tell us about the APL, and you wanted to give the schemes available for below poverty line residents of Karnataka, even for the above poverty line. Tell our viewers about that innovative scheme.
A country like India, where 140 crores people are there, everything cannot be done by the government. So we have got the private sector and the government sector. Whoever financially are better off, who can afford, they will go to the private sector. Who are not so much economically, they are not good, and those who want to take the free of cost service, we have got our government hospitals. And in Karnataka, we have seen that whoever goes to government hospital, either all facilities will be there. If the facility is not there for the BPL, below poverty line patients, in the private hospital, free treatment will be given. So on behalf of the patient, the government of Karnataka will pay the assurance scheme.
Right.
And not only within the hospital within Karnataka, the people in Belgaum, that area, they had only 1 or 2 private medical colleges. So we have an option Goa also. Whoever goes to Goa, they can have the treatment.
Oh, fantastic.
In the place like Bijapura, we are given in Sholapur and Kolhapur also, we are given the
in
opportunity.
Maharashtra state.
Maharashtra state also hospitals how people can go there. It's a border area.
You want to make sure that every resident of
Everyone.
Karnataka is
And see, in
covered.
Hyderabad,
Hook up.
Gulbarga, Bidar, they can take the facilities from Hyderabad. So for a, where the,
Fantastic.
in which state the hospital is there is not important.
It's
the
the
people of
service.
Karnataka was important for us.
You did it wonderful.
Yeah, that was on the BPL. So we are planning on the APL also in the future days to come.
This morning you participated in a International Drug Awareness Day, and I think there was 15,000 people. Sir, tell our viewers of something very unique you as the Health Minister, KHADER Saab, has introduced, the Super Tuesday concept. It's
Yes.
something phenomenal.
See, this mental health was highly neglected for a long time. As if the mental health, if any profession takes place also, not only on the patients, on the doctors also, people used to have something they're looking at.
Correct.
Why he has taken such type of profession. But now it is changing. So at that time, we wanted to see that a confidence is given for each and everyone in the village area also. So we made it a Super Tuesday. Every Tuesday, the doctors of the PSC will see
In all the primary
all
health
primary
centers.
of the
Wow,
state.
fantastic.
And all the taluk hospital also will see that day first the psychiatric and the mental patients will be treated, and whatever medicine is there that should be kept available. And the district one officer who is there in charge is to look after that.
So this is the first of its kind in the whole country. I've not heard of this.
Yes, in those it is 12 years back started.
When you were the first time health minister.
Now we have got Manoswini Yojana. Same thing we have kept as Manaswini Yojana.
Okay, sir.
And we have got one more scheme for mental health. See, people will be wandering out of the psychiatric problem or some other problem. No one will be ready to catch them. No one, if they catch them,
The stigma associated with mental health.
we can't. They won't keep in the police station. They can't put them in the
Absolutely.
jail. So we give the NGOs the amount. They select every district one NGO. That NGO's duty is to, who are wandering, who are separate, they'll be taken, they'll be treated and they'll be taken care of in the center, and the government of Karnataka will pay money for them.
Another innovative scheme you have implemented, Honorable Minister KHADER, is the Heart Sanjeevani scheme
yes.
in the rural health. Tell us about
See,
that.
in Karnataka, a lot of people throughout India or Karnataka, many youngsters were suddenly have a heart attack.
Absolutely.
So the government thought that we should do something. So every PSC, if any patient, if he feels like his heart problem is there, as if he is suspicious, he can go to the primary health center which is nearby his house. He can have free ECG. If any variation is there, injection will be given to stabilize him. Then he will be taken to the concerned hospital and the free of angiogram and angioblast will be done if it's necessary.
Fantastic. I mean, you're doing such phenomenal work. I think we have to put you on the global stage, not only for developing countries, including for developed countries. Another one of the unique schemes you have introduced and previously as well as now is the metro ambulance. I've never heard of it. I think the first time. So tell us about that metro ambulance.
See, ambulance, road ambulance, maybe it's a road ambulance or a boat ambulance. Every ambulance
Bike
is very
ambulance.
important.
Yes.
And bike ambulance. We were the first to get the bike ambulance in South Asia. And that was in the city level only. Because that's
Metro cities,
cities. But even if you have got ambulance, if any accident takes place, this because of the traffic, it doesn't go and reach on right time. So this ambulance will go, it will treat. If it needs, it will stabilize. Until this, our ambulance comes and takes it. Second thing, we had an ambulance of the 108 system. We want to reach it in 20 minutes. But now we are planning 12 to 15 minutes. We want to, we are planning it. We'll just roll it out day. If any ambulance comes more than that, we'll charge the fine on the ambulance service. Why you have come late. Because accountability should be fixed. Along with that, at the present situation, when the metro has come, you see thousands or lakhs of people travel the transit in the metro station. And once a metro station is, thousands of people are there in each station. We won't know what will happen, and if something happens to someone, not so easy to get them down, take them. It's all very... So we have suggested, and we are going to suggest and have a discussion with the metro people also. Every metro should have a mini ambulance compartment. Where
in the metro train
in
itself.
the train itself.
Okay.
One of the compartment, they should add one compartment in the middle of this one, where a structure will be there, stabilized oxygen will be there, and the patient can be stabilized until he reaches the hospital. If something happens to me on metro or on the station, I can be taken immediately When I go the next place where the hospital is there, the ambulance will be ready. So maximum duty is to save each one everyone's life. That will be remembered more than any development.
Yes. Another interesting scheme you have done is the accident insurance scheme, free of cost to anybody who has an accident. Explain how does
You
it
see,
work?
the people, and it's not only for the people of Karnataka. Anyone, any tourists, any students, any pilgrimages, any people come from different part of the world and India and the other state also. Yeah, if something happen like a bike accident, train accident, they won't. No relations will be there. No one will be there. They don't know who will take to the hospital. When the poor, the who has got humanity, who is poor, he'll take them to the hospital. When he goes there, the hospital will tell us first you pay the money. Then next no one will take them also. So made a system, accident that takes place. If there anyone comes and admits, immediately they have to admit him, they have to treat him. 13 years back when it started, it was 25,000 up to 2 days. Why 2 days? By 2 days, they'll come the conscience back. Then his decision to be that hospital or he should go somewhere. Or his parents will come and reach. Now we are increasing it for more than 1.5 lakhs in the days to come. We are planning, and that also was taken by the central government after we started.
I'm just listening to the amazing way you're transforming healthcare previously and now. So, where did you get your insight? Where did you get your inspiration? And how are you curating these wonderful programs, people centered programs, not heard before?
Yeah, I always say all these suggestions and this
Feedback.
ideas were given not by very educated people. It was all given by the common people only.
Right.
They know that, see, we understand what the difficulty first. What are the problem? When you see what's the problem, you'll get what is the solution.
Fantastic.
First, you have to see what's the problem is there. For that, what is the solution we should plan? Then we execute it.
Now, KHADER Saab, you have done where do you see your Karnataka Health Department under your leadership in the next 3 years? I'm sure you're having the AI digital health. So tell us how you're planning to take it to the next level.
We have got digital health and now we are into mobile health.
Okay.
Now the digital health goes a little back because everyone's mobile has got the
Mobile
system.
health, fantastic.
So we want to make a mobile health app. If I goes to
Fantastic.
that if he goes to that app, he'll come to know which hospital, which treatment, what is the facilities by the government. So such a innovative idea.
So you are going to develop a free digital app for the mobile phones and give it to the public free to have the blood pressure, diabetes,
yes,
blood sugar, heart rate,
everything.
exercise. Oh, fantastic. That will be
That
a
is
revolutionary.
yeah, that's a plan. We are planning it now.
Excellent. You are a mover and shaker. You revolutionized as food minister. I remember the ration stop, the biometrics. Could you just give us a brief, quick overview how you did that in 2016? Am I right?
Yeah, 2016.
Yeah, please go ahead, sir.
See, food department is a real-time duty. It's not a one-time duty. Really, you have to see them correctly. Whether food will come from the center to the state, state to the district, district to taluk, from taluk to the shop, from shop to should reach. By this end, a lot of filtrage was there before. A lot of misuse was there. First, we planned it to see that all the bogus card will be cut. And we said this is an other card. And when decided this, more than 60 to 70 lakhs duplicate card was eradicated, which was misused before, where crores of rupees were benefited for the state. Second thing is, we saw that the shop people will give on the right time to the concerned people. So we bought it a biometric. To get that also, it was not so easy. So we bought a coupon system. First we gave a biometric kiosk. And purpose is the shop people is to get spoiled. And when the people stay in a queue, they should tell the government is not correct. It is given this machine. And again they will do it manually. When manually is done, all the mishappenings takes place. So then we see the coupon system. The coupon system is, if I am a beneficiary from a house, I can go to any CSC or Panchayat. If I put my name, out of a coupon will be generated. In that coupon we mention, you take other 5 people from so many kgs of rice, so many kgs of sugar, so many kerosene is needed. How much it is. So the people come to know how much the shop people has to give me. They can't cheat the common people. They have to give exactly. Then after this happened, we bought it biometric only, direct biometric.
Metric.
Yeah. Where when he presses that, the details will come. So
Everything is very transparent
everything is very
and documented.
and the digital weighing machine also.
Okay.
So the clarity will, they can see the clarity clearly. If you 25 kg they should see 25 kgs they get. And for that, a lot of agitation, these things were there. Then before, in 72, this was given. Shops. And it was like a family property was continuing. It's a government property, government business. It is not
Cooperative
about,
union shops.
So we decide on the 60 age of one, if I have got an agency of a ration shop, at the age of 60, that will be cut. After that, a newcomer will be given. Why at the age of 60? By the age of 60, my children will be educated, they'll be engineer, they'll be doctor, police officer, something. And no one will take care of this.
Shop.
When I am age old and I can't, I've got enough, my children are earning, I don't feel like sitting in some ration shop and struggling.
So you'll have a proxy and rent
I
it
will
out.
give a proxy, people will take that. A proxy people, I saw one fellow at 20 to 30 shops
Wow. Oh my
in one
God.
place. When he has got 30 shops on proxy name, what he will do is get a bit, he'll be powerful.
Powerful, yes, like a little mafia leader.
Yes, he takes the influence of the local representative. He only puts it, depot manager, whomever he wants. And when the tender comes for the to transportation of the rices to the from the depot to the ration shop, he only takes the transportation tender also. So shop is also mine, transportation tender also is mine, the depot manager also will be
Yes.
mine. And
So
we
you
don't know.
just squash that whole scheme
Yes.
to make it transparent.
And they don't give for 1 to 3 months, they don't give. They said, right, they not come. Go and ask the government. We squash everything. We decide
Everywhere you're going, you're leaving your footprints of transformation, action, honesty, integrity for the people. And you're a people's man, a community hero from Mangalore. Sir, as the speaker, which was your last assignment of the House, you again created waves there. For the first time, you made ministers answer the questions. You also made how they should come and attend the centers. Tell our viewers how you did that and how challenging was that?
The speaker's was a very interesting, challenging post and a respectful post also. So once we sit there, we have to see that the assembly runs well. So I did it before it was 10:30, 11. Sometimes my morning 9 o'clock to night 1:30, 2 o'clock also we used to run the assembly.
Wow.
Always to participate, including chief minister to come at morning 8 o'clock and to reply to the members. And when they were not, sometimes when the ministers were not answering, I have taken them to task also. We have seen them, they give the answers. Sometimes the oppositions unnecessarily they violate the rules and they say democracy is important.
Absolutely.
Protest is important democracy, but
Very
there's a
good.
limit.
Correct.
When they cross the limit, I have taken severe action also by suspending from the 6 months without any benefit. But they're all within line. So to come early as a quorum, we have kept an award for those who come early. We give them award as incentives because I come early and the person doesn't come. So there's no difference. All will come late.
Correct.
So when I come early, if I'm getting some recognition, the award is not a big thing. Some recognition in their constituency, at least you'll feel happy. I've come early, I will recognized.
Right.
And some people come, they go out, again come. We won't know how many hours is inside the assembly, actively participating. So I put an AI camera also. So good. That will give us correctly how many days he was inside, how many hours totally.
Wow.
Those are good performance. Whenever we get a chance to send on a tour, on a training, we take this list. Who is parting with the interestly, we give them more importance. So that some type of
benefit for those who
take part actively.
Utilize the speaker's chamber and the assembly. You also made the whole assembly paperless.
Yes, with digitalization of the whole assembly, we have MOU signed with the central government, NEVA. Within 3 to 6 months, that will come as well. Because for more than paper, logistics very much problem. By the today
storing of the records,
only storing the record and agenda. When the assembly runs, if it continues at 1 o'clock, then 1 hour I have to sit and prepare today's agenda. After preparing agenda, that will go to the printing press. Once it comes from printing press, again that will be distributed to all the members. MLAs at night only. Because before morning they should get the agenda. What is the agenda for the program? So logistic, manpower, papers, waste, all this will be benefited in this. And I think economical also will be benefit for us.
You also had the credit of hosting the 2025 Commonwealth Speakers Meet in Karnataka. Sir, in closing, for 25 years you've been the MLA for the constituency in Bangalore. What are the highlights of what you've done for your constituency?
Mostly, our constituency very importantly needs is a cordial relation between all the communities, a unity of that area, where only during elections politics, after election only development, coordinating between all the communities and being a part of each and every community, so everyone will feel proud. Second thing, it is our road development. Whatever facilities we have got in city areas, we should provide in the rural areas.
Correct.
Otherwise, what happens? People come from rural and they'll come and settle in the city, where the rural will be neglected and more congestion will be done in the city areas. When you give a road until the people of the habited place lives, they'll take a vehicle and reach city within 20 to 30 minutes.
Great.
Then the 24 hours drinking water and for 20 time current. These are and education system for the school, good education system and good health system. If these things are there, I think every nook and corner of that our constituency, they'll be staying. They'll be happy and they'll be prosperous. Will be done.
Yes, sir. All our viewers would like to know a little bit about your personality. Such a transforming personality. You have done your LLB. In 3 words, how would you describe yourself, sir? 3 adjectives.
See, mine is mostly service-minded,
Service-minded, humanity,
and forgiveness.
You just heard the Honorable Minister KHADER, who has been a transformer, describe himself service-minded, humanitarian,
And forgiving yourself.
and forgiveness nature. Fantastic. So if you're given a chance to take 3 people out for dinner from the past to the present, they could be your mentors, heroes, who are your parents. Who would those 3 people be?
One will be the poorest of the poor in my constituency.
Excellent.
And one will be is an autistic, was a special child
So sweet.
with me. And one will be someone who will be appreciated by each and everyone. There will be different field.
Correct.
Any one will be, say, who will like more of them.
You just heard the man of the year, KHADER Saab, talk about 3 people. One would be the poorest of the poor, second would be an autistic child, and third would represent all the community. In closing, sir, we'd like you to give your message to our viewers, whatever we want to say, and we thank you for such an enlightening conversation today.
I thank VGP and their team for having this podcast and so on. It is nothing but transformation of my views to the entire public and taking the inspiration and the support from your team. So to work more and more better. I'm sure that the viewers of you have much more ideas concern health sector and the better helpful society. I request them, and each and everyone can give their suggestions. Whatever is good, we'll implement it. Because nation cannot be built only by government and politicians. When each one of section of the society, the media, the academician, the businessman, the entrepreneur, the woman, the general youth, when all join and give their suggestion, then only we can build a healthy nation.
Okay.
So I request each and everyone, please give your suggestion or any new initiative ideas, programs. I will take it, and I see that taking your support will implement it in our society.
Today, we are happy to announce that Mr. UT KHADER FAREED is the recipient of the Global Civic Leadership Award to be given at the 15th Annual AMEC Congressional Awards Gala to be held in Naperville, Illinois on July 25th, 2026.
Thank you, sir.
Sir, you are the first Indian to receive this global congressional recognition in Chicago area on July 25th. And after coming all the way down to Bangalore and hearing it, you're worth every ounce of it. And we are all excited to learn more about you and celebrate your leadership today.
Thank you. Thanks.
We just engaged in a most enlightening conversation with UT KHADER FAREED, Karnataka's health minister. He gave us his vision of transforming Karnataka into one of India's best public healthcare systems with measurable outcomes that should reach every citizen. He talked about bridging the urban and rural gap, technology and AI in healthcare, preventive healthcare, medical workforce, and about his own personal leadership philosophy. His insights and vision is incredible. And Mr. KHADER's perspective on accessible, affordable, and technology driven healthcare has been truly valuable. And I'm sure we would love our viewers, like he said earlier, to give your feedback and how you enjoyed this conversation. And he would love to hear from you if you can give him suggestions how to further improve the status of healthcare for Karnataka, with reaches every citizen. That's his goal. And thank you all our viewers for joining us again on Dr. VGP's podcast. Until next time, stay healthy, stay informed, and keep inspiring change. Thank you.
Huge thanks to everyone who tunes in to Dr. VGP's podcast. We've received the YouTube silver play button for reaching 100,000 subscribers and counting. We sincerely thank you for being part of this wonderful journey with us. Click on the subscribe button and hit the bell icon to notify you with all our future podcast contents. Thank you again.
Dear viewers, elevate your business to new heights and reach 35 million potential customers with Global Eye Digital. Contact us today at globaleyedigital@gmail.com or info@globaleyedigital.com. Let's take your business global.
Welcome to Phuket, one of the best places on earth. Phuket, a jewel of the Andaman Sea, is located on the southwest coast of Thailand. Here, the shimmering turquoise waters, with year-round temperatures never dropping below 29 degrees Celsius, embrace pristine white sand beaches that stretch as far as the eye can see. Phuket is one of the world's premier tourist destinations, attracting over 14 million visitors annually. Travelers come to bask in endless summer, relax on picturesque beaches, indulge in world-renowned Thai cuisine, experience the warm hospitality of the locals, enjoy vibrant shopping scenes, and revel in an abundance of leisure activities. The island's real estate market thrives on tourism, boasting record-breaking global occupancy rates, averaging an impressive 85% annually. For investors, Phuket offers lucrative short-term returns, making it an unparalleled hotspot for high-yield investments. Since 2004, Phuket 9 has been a leader in developing and managing investment properties on Phuket. With 20 years of experience, we have established exceptional standards in construction quality. Our portfolio includes luxury villas, condominiums, townhouses, hotels, and infrastructure projects. Our in-depth knowledge of the island allows us to identify the most promising locations, ensuring optimal property value growth and robust returns on investment. From the earliest stages of development, we strategically plan for both capitalization and profitability. To maximize returns for our investors, we created Hotels 9, a property management network that delivers seamless operations and consistent returns. This means truly passive income for our clients. We handle everything from marketing and maintenance to full hotel management services. What sets Phuket 9 apart is our dedication to creating vibrant, diverse infrastructure. We build not just properties, but thriving communities with amenities designed to enhance lifestyle and investment appeal. Our projects include international schools, children's entertainment parks, daycare centers, medical centers, shopping complexes, restaurants, bars, and much more. We are excited to introduce 5 new projects, each with its own unique features, prime locations, and investment advantages. Whether you're looking for a serene retreat or a high-yield property, we have something to suit every investor's needs. Join us in exploring the incredible island of Phuket with Phuket 9 as your guide. We're committed to providing comprehensive insights into the beauty of Thailand and the unparalleled opportunities in one of the world's safest, most beautiful, and most welcoming countries. Welcome to Phuket.